So today I'd like to present to you Beat the Heat, an application that will help you control your environment and beat fatigue by staying cool. So why were we here this weekend? Autoimmune disease such as MS affects 2.5 million people globally, and 66% of these individuals experience severe incapacitating heat fatigue. Okay. MS patients, next slide please. Individuals with MS love the cold. These are the implications of fatigue in MS. It affects many stakeholders, including the family of the patients, the education system, the workforce system, the clinical system, and the government system. And individuals with MS love the cold. They seek a cold environment whenever they can. And they'll avoid warm environments which are greater than 22 degrees centigrade, and they'll avoid exercise. So we'd like to develop an application which will help them overcome this difficulty with heat during exercise in warm environments.
Julie est une mère de 3 enfants dans la trentaine qui a été diagnostiquée avec la sclérose en plaques en 2013. Elle utilise l'application pour suivre les changements de température ambiant et de son corps pour mieux comprendre et gérer sa fatigue.
As you can see, this application will combine the body temperature of the individual with weather data to the mobile device, which can later be shared with the healthcare professionals and electronic medical records, so that they can have an output and understand how the individual is handling their fatigue. Next slide. So our application will help people determine their individual temperature threshold, be able to control their environmental conditions, minimize their discomfort, exercise with greater confidence, and improve their mental and physical health. In addition, next slide, we're anticipating other benefits which we're looking into and exploring further. And we could not do this without your help. So thank you very much to Hacking Health, the sponsors, mentors, organizers.
Un système complet. Un système complet. Messieurs, mesdames les juges, je vois des questions dans les yeux de Christian de Fasken-Martineau et vous, Manassé, vous avez quelque chose ici, là.
How much time do you expect to have a working instrument, or working one?
So we've already, so what you saw the other demo was a simulation of data. I would say the Bluetooth communication would take about 6 weeks to fine tune, make sure the connection, everything works well. The challenge is the actual sensors. Exoskin, so you can imagine this working with maybe shirts that detect body temperature. So I would say maybe 6 months we could have those kinds of sensors and integration, have a working minimum viable product.
And how much you think it will cost to implement this technology for a patient?
To who? For us or for the patient? Ideally, we see this, so especially in Canada, as being offered by the organization. So we would sell it to universities, researchers, Sainte-Justine, who'd want to, or do you want to come on? And eventually maybe have in-app purchases for the patients who want to add a second sensor, maybe measuring another metric like heart rate. So it's both the organizations and the patients maybe in-app purchases.
Current solutions in use are cooling vests, which involve 10 kilograms of fluid in a box, and it's used wheelchair mounting, and they cost around $800. So we anticipate we can be below that price.
Autre question?
Oui, rapidement. Sorry, quickly. Are there any features to give feedback to the user, like recommendations, like use maybe GPS technology to point them to a cool area that they can go to? Can you talk to them?
Exactly. I don't believe that you were able to see it in the slide presentation, but the alert when the temperature threshold is breached will actually have a link to a nearest water fountain or a cooling center or a place that will give you a cold beverage or a climatized environment.
Bravo!